Okay, with that, we're going to go into Kathy McKay and Cheryl and Jamie. You were wondering what to call us a while ago, the three what, musketeers or something?
Amigos.
Okay.
Yeah. Good morning, Mr. Chair and
Good morning.
Commissioners. You should all have the handout of the data, our typical information that we hand out. So we're looking at our positive cases of 5,089 in Clay County as of yesterday, 57 deaths, and our 14-day case rate per 10,000. We are watching this number rise. As you can see, it's at 183.28. So it definitely continues to rise. And then in Minnesota, our total positive cases are a little over 318,000. Cumulative deaths are 3,593 at this point. The positivity rate in the state of Minnesota is 7.4%. Now on the back page of the whole stapled information, we have Cass County's numbers as well of 16,788 cases. They have 126 deaths, and their North Dakota's cumulative positive rate is 22.63. So they continue to be high as well with their numbers. As you look at, so the second page shows the graph of, just a graph covering the information about the total cases and the number of deaths, and then those no longer needing isolation. So after their 10 days of isolation, then they are out of isolation is what we talk about. And then the grid that shows each of the weeks, starting from March, where we're looking at confirmed cases, those no longer needing isolation, deaths, and active cases. So it varies a little bit just because of the dates. So as of November 25th is our last date of those numbers. But as we've talked about previously, you can see how much they've risen even since September. So each week for a while it was in the 100, 150, 180 range. Then in October we started seeing quite an additional number of cases in the 200 to 300s, and now we're well into the 600s in November. So each week, that's the number of cases that are increasing. So it's no wonder that those that are doing the contact tracing and case investigation, really have their hands full, both with MDH and our own staff providing that contact and case investigation. And then we also, on the graph, the last page where we show the cumulative cases, again, it's just showing the age ranges. The first graph is the one we typically put out with the age ranges of cumulative cases in Clay County. And again, you see the 20 to 24 at the highest, and then the 15 to 19, 25 to 29, and 30 to 34. So that's the typical age ranges of the cumulative. You also then see the second graph that Commissioner Campbell had requested. We had this last week as well, that shows the active cases. So it's giving you the age ranges of the active cases. So, it's a little bit of a difference in the active cases and the cumulative, but nonetheless, it's still showing that the segment that is the highest age ranges, but we're still seeing basically the 15 to 19. Those ages of 10 to 14 are increasing as well with the number of active cases. So you can see the spread of those cases and the different age ranges that we're seeing currently. And it still kind of goes to the factor that, we continue to be the voice of, trying to maintain the public health measures that we talk about, the social distancing, the masking, all of those measures. And, it's great when people are complying with that, because we do want to keep businesses open, and we do want to, ensure that we have safe school systems for the kids. So we really, that's the point. It's not punishment to try to follow these measures. It's really to try to keep our whole community safe. And I know it's hard, and there's people out there that aren't complying, but if you think about, we're doing this to keep the people around you safe and trying to maintain our economy and the schools. So I mean, there's a method to why we really are pushing that, really not doing large crowds. We talked about that before Thanksgiving. Really not doing the large gatherings that you typically are used to. Now, we know that there's a lot of people that comply, but we also know there's people that did not. When they talked about no travel, there's a lot of travel going on for Thanksgiving. And although it's a hardship, we do this for a reason. We want people to be safe. We don't want to see we want to see these cases come down. We want to reduce the amount of people that are dying from COVID. So there's a reason why we talk about all those public health measures. So it's just the reality until we get the vaccine, and they'll be talking about the vaccine in a couple minutes. So any questions on the data that was passed out?
Kathy, can you explain for the public asymptomatic again?
Yes. So there's a number of people that are asymptomatic that have the virus. And typically what we say when we do our case investigation and contact tracing is you can be asymptomatic and spread to others. So you don't feel ill, you don't have the cough, body aches, you don't have any of the symptoms, but you still have the virus circulating and it's contagious. So you can still spread it. So what we do when we talk to people is when you become symptomatic, you have to go back 48 hours because you were infectious 48 hours before you develop symptoms. And so at that point, you can spread it. So when people say, I was well, I felt good, that's true, but it doesn't mean that you didn't have the virus. So especially when you're doing the gatherings, everybody felt well, we were all okay. You can still spread it. You can still have the virus circulating, and you can still spread it. And typically we're seeing that. So someone may become symptomatic, and we're telling them you must go back to 48 hours and then determine who you were in close contact with, because you can spread it as an asymptomatic spreader. And we do have a lot of asymptomatic spreaders. There's a lot of people out there that don't have symptoms. They've been in groups, and that's a lot of the spread we're seeing in the community.
I would imagine that looking at, I really like the Clay County chart here with active. That really tells a lot to me, I think. And again, it looks like that 15 to 44 is really a strong area for these active cases. And I can only imagine then that in that same group, there's probably a significant number of asymptomatic people.
Correct.
And I just don't know if those people are getting the message of asymptomatic and that they can be out there. And this goes to the social distancing and the mask wearing and why it's so important to do it. Mm-hmm. I just heard on national news today that there was some counties in one state, some had a mask mandate and others didn't. Mm-hmm. And the counties that did not had a rise in cases and compared to those, and I'm not suggesting, everybody just needs to wear their mask.
Right.
But
yeah.
Education, I think, is so important, and I don't know that enough people understand what asymptomatic means.
Yeah, I think that's good, and we can get more of that out as we do more of the media information. In your conversations with people, just right.
ask them if they can explain it, and my guess is they won't be able to.
Yeah, I think you're right about that. There needs to be more education. And wearing the mask, it's not fun, but once you've done it for a number of months, it's just a habit. Just put your mask on, and it becomes kind of a habit and it's a good thing we have something before we get the vaccine. But I'll let Jamie talk about some of that information.
I'll talk about some of the highlights from the governor's conference, then we'll let Cheryl share the good news about So yesterday, the press conference with the governor, just, I know Kathy shared the numbers, but just a few things to highlight, that hospitalizations have tripled since mid-October. So really looking at the 25% of the hospitalizations in Minnesota, the non-ICU, are COVID patients, and 35% of the ICU beds in Minnesota are COVID patients. So the governor's just kind of trying to tell the public like what has changed. The case rates of the week of November 8th through the 14th were 9 times higher than the peak the week of May, our highest in May. So 9 times higher than in May. More than a third of the Minnesota counties have a weekly case rate of 100 cases per 100,000 people. And that 10 times higher than what is considered a high threshold of 10 cases per 100,000 people. So those were some of the things that he pointed out as far as changes. And then he shared some of his final thoughts, being that this is the worst spot we've been in since March right now. MDH will look at the data in the next few weeks to see the effect of the 4-week dial-back period. So really just explaining why we're doing what we're doing in Minnesota right now. And then I also just wanted to share information we've talked briefly about, but there is the opportunity for antibodies treatment for COVID now. It's for high-risk people, and that's age 65 and older, and those with chronic health conditions. It's a one-time IV antibody treatment, and it is available in our community.
Jamie, did you say 65 or 55?
65.
65?
Sorry,
Yeah, I know.
And those with chronic health conditions. So if you're younger than that, it would be also. So the idea is to catch people with chronic health conditions and the elderly prior to hospitalization for that one-time IV transmission of antibodies, which is available in our community now. And then, let's see. Also wanted to talk a little bit about our homeless population. We've had an opportunity to partner with Minnesota Department of Health and our homeless population, those that serve our homeless population, and they did a testing this last week of all people in the shelter. And there was a 25% positivity rate. So Rory Beal, our health promotions director, who's working closely with the shelter, was busy helping to move those that were positive tests, because anyone who's a positive test, we move them to our hotel that we're partnering with. And that was to isolate those that were positive. But also wanted to note that of all of those 25% that were tested that were positive, only one of them had symptoms. So back to what, we talked about the asymptomatic. They were all positive. And so in partnering with the Minnesota Department of Health, they will be testing every week. But in the meantime, because of the close quarters, the homeless shelters are quarantining. And again, they'll continue to test weekly through the end of the year to identify positive cases. So anyone who's positive is moved out of the shelter. Anyone in the shelter is quarantined. And you're aware of the grants that we've used to serve the homeless population. I spoke with Rory Beal before I came, and we're at about $70,000 that we have left. He's anticipating that we would run out of money mid-January. However, he has recently submitted an app, or he and Kathy have submitted an app from application from DHS that would carry us through June if that application is approved as well. Anything you want to add to that?
I think you covered it.
Okay. Oh, and I just want to finally just note that we talked quite a bit about the Minnesota Kovid app. I want to encourage people to download the app. It's very simple, the way it works. I did it. It is actually, if you just Google Minnesota Kovid app, it'll pop up for you, and it'll give you all kinds of information about how it works, the process. There also is, so basically, if you test positive when you're contacted by a case investigator, you're given a code. You enter the code into the app yourself, so it's you that's agreeing to share that information. And what it does is it communicates with any phones that would have been within 15 minutes, within 6 feet for more than 15 minutes in any place. So it doesn't say where you were, it just notifies you. So if I enter my code, you would get a notification if you were close to me for more than 15 minutes. It'll let you know. It doesn't tell you where, just that you were a close contact and that you should quarantine. If I get a positive test, if I go get tested, and the case investigator hasn't called me within a few days, I can call the Minnesota Department of Health and I can get that code. The code is only given to you if you are proven to have a positive test, so it's not something that you can do. And then we talked a little bit about the cross-border thing, and it does actually, if you have the app on the North Dakota side, it does communicate with anyone. As long as the state is participating, North Dakota is. Okay.
So, Mr. Chair, can you explain, so, and I asked this in an email to you, so if I tested positive and I got a code, at some point in time, you're no longer contagious. So at some point, does that information of mine come off, or is it going to stay on 6 months from now and I'm within 6 feet of somebody for 15 minutes? Or is this going to still tell them that they were in close contact?
No, because basically what it is I can't find anything that says it's wiped out, but basically the focus is on the infectious period. So
Okay.
Once I get that positive test, hopefully I'm isolating so there would be no contacts around me.
Right.
But before that, the infectious period, we talk about going back that 48-hour period of time. If I were continuing to not follow the isolation and I was around people, they would continue to get notified during my infectious period, which is a 10-day period of time. And then that's it.
Okay. Because I don't want to put false worries into people either that they're going to, I tested positive for COVID on September 28th, and certainly if I'm within I don't want them getting a warning because of me now.
And that wouldn't be the case because you didn't have a code to enter into the app.
Right. Yeah, but had I had a code.
Right.
Yeah. Okay, thank you.
Yeah. Okay.
Okay, and then Cheryl will talk about some of our testing site and vaccine information.
Good morning. So for our Vault saliva testing site, I have some numbers from the week of November 22nd. There were 4,503 tests conducted that week. For Minnesota residents that were tested was 2,440. Non-Minnesota residents were 2,063. Total number with results available was 2,415. There were 417 positive results with a positivity rate for that week of 17.27%. So they were closed for 3 days during Thanksgiving week last week, but they're back up and running and people are utilizing it. We still are taking calls from people that are wondering where they can go be tested in Clay County, and so we are definitely sharing that information with them. And I think I know that we have no idea what the end date is going to be for this test site. We were initially told it was going to be probably towards the end of this year, but we haven't heard anything different. So knowing with the spikes that Minnesota has had, we keep waiting to hear from Minnesota Department of Health if they're going to be able to extend their contract with Vault into the new year, which I think most people would be grateful for because it's been a tremendous opportunity for people to be tested.
That is still a 7-day operation now, isn't it?
Back to 7 days, yes. They were just closed for 3 days last week for the holidays.
But
so.
they're not, yeah.
Mm-hmm.
Mr. Chair, I got a couple more. I apologize for the questions, but it's
That's okay.
a good chance to get the information for the public. The people that have been going to that test site, are they asked if they have been experiencing symptoms or not? Or
Yes. It takes you through a course of questions, a series of questions that you have to answer. And yes, whether or not you have been exposed, whether or not you're having symptoms, those are two of the questions that it does ask.
okay. I'm kind of curious as to data that might come from that to, are 50% of the people going there because they're concerned that they have it? Or are they going there because maybe they're interested to find out if they might be asymptomatic? There can be different reasons for going.
I've taken a number of calls from people. Some people have said they have to travel for work, and they need to have a test done before they go.
Sure.
Because rapid tests are not readily available for everyone in our community. Some people are saying that they have to take care of a grandchild or someone like that, and they will go for those reasons. So I think it's really all of the above. People are going because they've had symptoms. They may feel like they may have had an exposure at work or out in the community, and they're going for lots of various reasons. But I have taken calls from people that say, asking me, is it okay? I don't have any symptoms, but I'm concerned that I may have been exposed. Is it all right for me to go to that testing site? Absolutely.
And then one last thing, and I guess maybe not for today, but maybe when you come back next week I'd be interested to know a little bit more about antibody testing.
Okay.
And what is there any research out there? I know before we've talked about that period of maybe 90 to 120 days. If you've had it, you might be free from getting it again. Is there any more new data on that? We don't have to talk about it today, but maybe if you could come back to us.
Sure.
And then also, is there a way for those who could be tested to find out if they have the antibodies? And if so, where would they go? And that goes back to the plasma deal.
Great. Absolutely, we can get that information for you.
Okay, thank you.
Any further questions on the test site or testing at all?
I don't know, Jenny or Jim, do you have anything?
Jenny looked like she's trying to say something here.
Jenny, looks like you froze up
She
on
froze.
us. I think we just lost her.
Uh-oh.
She'll probably reconnect.
She's gonna check. Yes, from reading the state website, we tested almost 100,000 people statewide a couple days ago, didn't we?
I do not have that information with me.
Tested it. I don't know if I have that.
It's not mentioned in the governor's stuff.
It's on the Minnesota Department of Health virus page.
Okay.
I'm not seeing it.
They have on the first page, we have the approximate number of completed tests cumulatively. So they've got a cumulative number, but I don't have just a weekly number on that.
That's on their page. Yeah, it's on their page.
Yeah.
Okay. All right, so next, just gonna give you a little brief update about our vaccine planning for COVID-19 vaccine. We are actually on track with our vaccine planning for COVID-19. Our initial vaccine, which will be Pfizer, is the manufacturer, and that is for ultra cold storage. And that, from what we meet about 3-4 times a week with MDH, with our West Central Healthcare Coalition and that. And of course, things can change on a daily basis, as everyone realizes. But we're actually ahead of the game with our planning. Surveys have been sent out to long-term care facilities to basically just assess their capabilities, to be able to vaccinate their healthcare workers, if they have vaccine storage, those types of things, and any resources, because it just helps local public health know what the long-term care resources are so that we know how much support we would need to help them provide. So the initial Pfizer vaccine, from what we hear, and we have another meeting this afternoon with Minnesota Department of Health, should be coming sometime mid-December. Of course, those doses are going to be a limited amount, since from what we know right now is they will be going to hospitals and healthcare workers. And then within a week or two after that, the Moderna vaccine, which is a frozen, under normal frozen conditions, not the ultra cold, which is about 80 below, will be coming about 2 weeks later. And we're still waiting to hear, at the federal level, they're still determining the different phase groups of who will receive that initial Pfizer vaccine, and then the next level would be, of course, the Moderna vaccine, which again is under the frozen. So it will be much easier for local public health to help manage. We have storage capability for that type of vaccine, and how that will be distributed. So we're waiting to hear how those phases are going to roll out, who's going to be included, because they're still having conversations about that. So, but we, like I say, we have meetings practically daily with either our regional healthcare coalition or also with Minnesota Department of Health. So
It's my understanding the Pfizer vaccine requires 2 doses?
as far as I know, they all will require 2 doses.
Oh, they all
yes.
will, okay.
Yeah.
So the number that you get when you in terms of vaccinations, you really got to divide that by 2.
Correct, and it's not just getting a second vaccine, but getting the same vaccine the second time that you received initially is important as well. So if you received a Pfizer vaccine the first round, that is what you need to get the second time also. So there's many decisions that are being decided at the state and federal level to help figure out how to accomplish this goal. So it's a huge undertaking.
And we have a vaccination plan that Josh from my office has created, and this is due to the state, so we have to submit there's no signature required by the board, but we have to submit our public health vaccination plan by Friday. So we're working on the finalization of that plan.
Do you see, obviously, we talked about this during our CARES committee meetings, and because of the limitations on when we had to spend those funds, we don't have funds right now, local funds from the CARES for that. Do you anticipate a large expenditure in providing that vaccine to everybody? Is that something that we need to start preparing for, and are we going to get some federal state help?
Yes, we the vaccine that will be provided to us at no charge to the local jurisdictions, as well as some of the syringes, et cetera, that go with that. But it will be a large undertaking if we need to, and we will in some way, shape, or form need to provide some mass dispensing. We know that, like Cheryl talked about with the long-term care, it's very helpful that they can provide their own vaccinations within their facilities, the healthcare systems as well, so that's helpful. We'll have some 2 pharmacies that have entered into a provider agreement to provide vaccines, so that will be helpful for local public health, but there's still a large portion out there that we expect to be responsible for mass dispensing. So I anticipate there will be it will take a lot of staff resources to provide the mass dispensing site. And we don't anticipate doing the general population, of course, until into 2021. I mean, there's going to be a delay because they are going to work with the critical and essential workers first. So they'll have their phases. So we anticipate that it will be, maybe into the spring before we'll need a mass dispensing of the general population. More of that detail to be worked out. Other questions that you may have for any of us? And
I don't know, Jenny, are you back on again, or are you just,
Yes, I'm on.
okay,
I'm just having trouble with my Wi-Fi, so I'm shut my video off.
okay, very good. Do you have any questions, or?
should also, just one more addition, besides the vaccination plan, we need to enter into a provider agreement as well. Even public health needs to enter into that with the state. So we're just finalizing our numbers of critical and essential workers. And once we've completed that, we have the medical director that we utilize that has already provided the signature. And we meet all the requirements for vaccine distribution. So we'll be submitting that. That also does not require a board signature on that authorization, but just so you know, we'll be entering into that and hopefully submitting it today.
Okay. All right. Thank you so much for that update again, very informative.
Thank you.